Introduction. The term diabetes commonly refers to diabetes mellitus, a metabolic disorder that leads to excess sugar or glucose in the blood. Glucose is the main source of energy for the body. Once food is digested, glucose enters the blood and is carried to various cells and tissues. Elevated blood sugar levels following a meal cause the pancreas to release a hormone called insulin. Insulin helps glucose in the blood to enter the tissue cells, where it is used to produce energy for different activities, thus bringing sugar levels in your blood down to normal.
The normal range of blood glucose while fasting is 70 to 99 milliliters per deciliter of blood. Increased levels of glucose in the blood leads to diabetes mellitus. Causes. Diabetes can occur if the pancreas is unable to produce insulin or if the cells are resistant to glucose. Thus, an increased amount of insulin is required for the cells to be able to absorb glucose. There are two main types of diabetes. Type 1 diabetes is an autoimmune disease where the body's immune system attacks the insulin-producing cells of the pancreas, resulting in little or no insulin production. Type 1 diabetes is also called insulin-dependent diabetes or juvenile onset diabetes, as it is commonly seen in children. Type 2 diabetes is much more common and occurs due to insulin resistance, which may be associated with inactivity, obesity, and genetic factors. It is also called adult onset diabetes, as it occurs mainly in adults, though it is becoming more common in children with the increase of childhood obesity. The other types of diabetes include prediabetes, where blood sugar levels are raised but are not high enough to be diagnosed as diabetes. This condition usually precedes type 2 diabetes. Gestation diabetes is a type of diabetes that may occur during pregnancy, as hormones produced for the baby's growth and development block the action of insulin, raising the mother's blood sugar levels. Once the baby is born, blood sugar levels usually return to normal. Other risk factors for diabetes include increased age, ethnic background, and high blood pressure.
Signs and symptoms. Diabetes is often a silent disease. Symptoms may not appear until blood glucose levels are significantly high over a long period of time. So it is not unusual to have diabetes without being aware of it. The common symptoms of diabetes include increased thirst, increased hunger, frequent urination, lack of energy, blurred vision, infections, and weight loss. Complications. High blood sugar levels over a prolonged duration can lead to complications affecting many organs in the body. Diabetes can damage blood vessels, causing poor circulation, which can lead to heart attack, stroke, kidney disease, damage to the retina in the eyes, nerve damage, poor wound healing, gum disease, skin infections, and sexual dysfunction in men. Diagnosis. To make a diagnosis, your doctor will review your symptoms and perform a physical examination. As symptoms usually appear later in the course of the disease, screening is recommended for those with an increased risk of diabetes. This includes individuals over the age of 45, those with a body mass index greater than 25, and those with a history of gestational diabetes or pre-diabetes. Diabetes is mainly diagnosed by checking the level of sugar in your blood. A blood glucose test may be performed at a random time or after an overnight fast. Hemoglobin A1C is a test that checks the amount of sugar attached to hemoglobin, the oxygen-carrying protein in red blood cells. The glucose tolerance test involves testing blood sugar after an overnight fast and then periodically after drinking a sugary liquid. Type 1 diabetes may be diagnosed with a urine test for ketones. Tests may also be performed to see if your immune system is producing
antibodies
against the insulin-producing cells in your pancreas. Treatment. Treatment depends on the type and severity of your diabetes. Your doctor may recommend lifestyle changes, oral medication, insulin along with blood glucose monitoring, and measurement of carbohydrate intake. Insulin is administered in the form of injections or with an insulin pump. You will be educated on glucose monitoring, which may have to be performed several times a day. Glucose levels can vary with physical activity, food, medications, illness, and stress. People who receive insulin must check sugar levels more often. Blood glucose is usually monitored using finger sticks and a blood glucose meter. Regular A1C tests are also recommended so that average blood sugar levels over a few months can be determined more accurately. An implanted continuous glucose monitoring device is also available. You will be advised to eat a healthy diet and watch your sugar intake. A dietitian can help you with a personalized diet plan based on your food choices and lifestyle. Exercise and physical activity are important as they lower blood sugar levels and insulin resistance. 30 minutes of aerobic activity a day is recommended. Diet and exercise can help you maintain a healthy weight, which also helps in controlling diabetes. Those who are overly obese can benefit from bariatric surgery, which has been shown to reverse diabetes as a result of the associated weight loss. Pancreas transplant surgery may be recommended for those with type 1 diabetes. Keeping gestational diabetes under control can help prevent complications during pregnancy and labor. Your doctor will monitor your glucose levels regularly and provide adequate treatment. Summary: diabetes affects the way your body uses glucose. High blood sugar levels can lead to various complications. Adequate treatment, preventative measures, and a healthy lifestyle helps most people improve the length and quality of their lives.